So there was an article, one of our community members reached out to me. There was an article on the Fresno Bee, I believe it was this week, about Fresno County having to give back some of those emergency beds due to them not having enough medical providers.
Right.
And so, do you think that we always talk about our physician shortage in this area? And do you think, and she wanted to know, she said, what does that mean when they give you emergency beds? Is it actually physical beds, or how does that work?
Yes. So Fresno County, I believe, had initially received an allocation of emergency beds. I don't know if it came from the state reserves or the federal reserves. They're generally coordinated by FEMA, but they'd received an allocation of 350 beds. And they initially were going to set up kind of a makeshift hospital out at the county fairgrounds. But then they decided to pull back 100 of those 350 beds because the county of Fresno was not able to demonstrate that it had a sufficient number of physicians to be able to staff those beds. And certainly, as the government is trying to allocate resources, whether it's beds or PPE or ventilators, they want those beds to go to places that they're certain will be used. And they were not certain. They were afraid that if they sent those 100 extra beds and there were no physicians to care for the patients, that those beds would go unused. So that's my understanding of why those 100 beds were pulled back. And absolutely, the San Joaquin Valley has one of the most severe shortages.
No, I have on the phone.
Sorry, we need somebody to mute their phone there. So as I was saying, the San Joaquin Valley, the Central Valley, has definitely one of the most severe physician shortages of anywhere in the state or the country. We have roughly one physician for every 2,700 residents, one primary care physician, where statewide it's about half that. So one physician for every 1,300 residents. So we haven't yet, as a county, requested any additional beds from the federal government. I did talk to Randy Dodd, who is the president of Adventist Health Tulare, I'll say earlier this week, maybe it was last week, about what we might do similar to Fresno County, and certainly the Tulare County Fairgrounds came up as a potential site, and definitely the convention center would be another potential site. So, but we might find if we made that same request of the federal government that they may come to the same conclusion, that because of our physician shortage, they may not make a full allocation to us.